Returning stronger or returning too soon? More evidence that Arizona's COVID-19 numbers are going in the wrong direction, coming from the state's largest healthcare provider. All of this comes as we mark the loss of more than 1,000 lives to the virus and a new high for reported cases. Of the state's 24,000 plus cases, nearly 1,600 were confirmed yesterday, the end of a record week of reporting. That spike now putting pressure on our local hospital system. Banner Health, the state's largest healthcare system, now saying their intensive care units are approaching 100% capacity. And Banner's top doc is urging Arizonans to take action now to prevent overwhelming the hospitals in the weeks to come. ABC 15 investigator Melissa Blasius has been monitoring hospitals' response to the pandemic. She has the very latest.
If the increasing trend continues of what you're seeing up here, we will exceed our capacity.
Sobering words from Banner Health's chief clinical officer, who's concerned about rapidly increasing case numbers and the impact on her hospital's ICUs. Look at this chart showing Banner's COVID patients on ventilators tripling since mid-May.
We're seeing a lot of incredibly ill individuals with COVID.
Banner says it's made plans for this possibility and will move to its 125% capacity surge plan for ICU. And it still has 50% of its ventilators for adults ready and available.
This was our expectation.
This week, the governor had indicated an increase in COVID case numbers statewide was attributable largely to increased testing. But health officials are now saying the end of the stay-at-home order is having an impact, especially when crowds are hitting the nightclubs.
All of these indicators together tell us there's an increased spread in the community.
At the county's public hospital, Valleywise Health, doctors say they are seeing more patients with positive COVID tests, but not a spike in COVID admissions yet. Hospitals across the state hit a peak on overall inpatient numbers this week due to a combination of coronavirus and an increase of elective surgeries and other patients.
The message is we need to be, as a community, need to come together to make sure that we're doing the things that we can protect ourselves and protect our loved ones.
They're asking people to increase washing their hands and surfaces, social distancing, wearing masks in public, and staying home if sick.
There are things that we can do so that we hopefully never have to go all the way back to an extreme quarantine situation.
Hospital administrators tell me that the state numbers you're seeing about their capacity is their regular capacity, but every single one of them has a plan to increase beds by 25%, as much as 50%, just in case the outbreak here becomes severe. I'm investigator Melissa Blasius, ABC 15, Arizona.